Welcome, I am Dr. Kazmi. So today we're diving into this, it's a high-stakes medical mystery where the most obvious answer is almost always the wrong one. We're talking about a condition that puts on the perfect disguise, and it can lead even the sharpest doctors down a really dangerous path. Alright, let's just jump right into a classic and frankly a pretty terrifying scenario that plays out in hospitals everywhere. You've got a child who's critically ill. They've got the fever, the racing heart, super high levels of C-reactive protein, CRP, that key marker for inflammation. Every single sign is screaming sepsis, this life-threatening response to an infection. So the team, they act fast, right? So they start these powerful broad-spectrum antibiotics and then crickets. Nothing happens. And this is that critical moment. It's that pause, that little flicker of doubt when a clinician realizes, wait a minute, the story just isn't adding up here. The treatment's failing. The evidence is all over the place and the patient is actually getting worse. So what on earth is really going on? Okay, so that brings us to our first section, the sepsis imposter. This is all about what happens when it looks like an infection, but it's not. So the core concept we're talking about here is something called medical mimicry. And what that means is a patient's own immune system just goes completely haywire. It launches this massive, and I mean massive, inflammatory attack on the body. And it creates this perfect storm of symptoms, a storm that looks, for all the world, identical to sepsis. And right here, you can see that central conflict, that real puzzle. On one hand, the patient has all the textbook signs of an infection, right? Fever, crazy high inflammation markers, a huge surge in neutrophils. Those are the immune system's first responder cells. But on the other hand, the hard evidence, that positive blood culture that would nail down a specific bacteria, it's just not there. And the antibiotics, they're doing absolutely nothing. All right, next up, section 2, when the clues contradict. This is all about knowing exactly when to hit the pause button. So these are the big bright red flags that should make everyone in the room stop and think. First, you've gone 48, maybe 72 hours and the patient isn't getting any better on those antibiotics. Second, your tests are coming back negative. Blood cultures are clean. You can't find a source of infection on any of the scans. And then you see the labs are actually getting worse. Key blood counts are dropping, a condition called cytopenia, or maybe their liver enzymes are climbing. And finally, the patient's mental state changes, they get confused or disoriented. That's when you have to start thinking differently. That brings us to section 3, reading the red flags. Let's get into the detective's toolkit here. Okay, so the first clue is a lab test called procalcitonin or PCT. Now, you can think of this as an inflammation marker that's way more specific to bacteria. See, in a real bacterial infection, both your general inflammation marker CRP and this more specific one PCT are going to be sky high. But, and this is the key, in a lot of these autoimmune mimics, the CRP is through the roof, but the PCT, it's surprisingly low or even normal. That mismatch right there, that is a huge clue. But while that PCT test is a fantastic clue, there's another one that can be even more powerful. It's a simple little protein called ferritin. Normally, it just hangs around, helps store iron in your body, but in these cases, wow, it can be the one single key that unlocks this entire mystery. Yeah, when your ferritin levels aren't just high, but they're astronomical, we're talking over 10-0, that is a massive, massive signal. It's like a giant flashing neon sign pointing directly toward a very specific and very scary group of autoimmune conditions. Things like Macrophage Activation Syndrome or MAS or HLH, conditions where the immune system literally starts to eat the body's own cells. And what's so interesting is that different mimics leave behind different fingerprints. It's all about pattern recognition. For example, if you see a child with a fever and their blood counts, like their platelets, are just plummeting, that pattern points you towards something like MAS or maybe a lupus flare, these diseases of extreme immune overactivation. But what if the patient has a fever paired with really dangerous blood clots? Well, that's a totally different pattern. That points to something else entirely, like antiphospholipid syndrome or APS, which is an autoimmune clotting disorder. It's the specific cluster of symptoms that's the real key. This all leads us to section 4, a high stakes decision, because now you have to choose a path. And let's be clear, This isn't some academic puzzle we're trying to solve for fun. In conditions like a severe lupus flare or vasculitis or MAS, making the right call and making it fast can literally be the difference between life and death. There is no room for hesitation, so the team is standing at a fork in the road with two completely different paths ahead of them. Path A is to just keep going, to escalate the antibiotics, treating an infection that isn't even there and that does nothing to stop the real problem. Or there's path B, you pivot hard. You start aggressive, powerful immunosuppressants. We're talking high-dose steroids to finally calm down that out-of-control immune system. And in this moment, choosing the right path, well, it's everything. Which brings us to our final section and really the main takeaway here. Think beyond the obvious. So these right here, these are some of the most common and most dangerous imposters you need to have on your radar. The big lesson is this. When all the signs of inflammation are absolutely screaming at you, but your tests for infection are totally silent, you have to expand your thinking. You have to consider the possibility that the body is actually attacking itself. Really, it all boils down to one simple but really profound idea. Not all fever is infection. When the cultures are silent, but the inflammation is loud, you got to think autoimmune. It's a great reminder that in medicine, and maybe in life, the first and most obvious answer isn't always the right one. And that really leaves us with a final thought to chew on. This whole principle, it doesn't just apply to sepsis, right? Being a great medical detective or really just a good critical thinker in general, it means you have to stay curious. You have to always be asking that question, what else could this be? And you have to always be willing to question what seems obvious. Thanks so much for joining me on Pediatrics with Dr. Kazmi. Have a great day.